for clinicians and other care providers. Our expert in the area is Denise Tafoya-McNevin. She's going to introduce herself in just a few slides. Welcome. We'll have an hour for this webinar. The last 10 minutes will be for question and answer. So I would love to know where you all are from. So what state are you living in, or are you from? If you wouldn't mind using your chat function and typing in. I'm Katie Langland. I work through the Denver Prevention Training Center. Denise, do you mind forwarding the slide? Thank you. I work in Denver, Colorado at the Denver Prevention Training Center. Our center has been around since 1978, and we work with training and consultation to increase capacity of health care professionals. And we work through Denver Health and Hospital Authority and also the Public Health Department. As you see here, some of these photos are some of our clinicians. We also have a clinical branch. Next slide, please. We're one of 21 organizations that have been funded through the Centers for Disease Control and Prevention to provide capacity building assistance to health departments, community-based organizations, and healthcare organizations. And so we help build capacity in regards to HIV testing, prevention with people living with HIV, people not living with HIV, condom distribution, organizational development, and policy. Great, so I'm gonna look and see where folks are from. Awesome, we have quite a few states represented. We have Colorado, New York, California, Nevada, Florida, Ohio. Wow, we almost have all 50 states represented. Thank you. Next slide, please. We will answer questions at the end of the webinar. If you could also use that chat box for your questions. Kim and I will be going through them. Kim is our technical expert, so if you have a question, you can chat her individually if you're having a problem with sound or something like that. But Kim and I will be going through the questions, and Denise will answer the questions at the webinar. You're welcome to use the chat function whenever during the webinar, and we will use that function to answer questions. Okay, next slide. So, like I said, Kim is our technical expert for the webinar. You're welcome to chat her individually if you're having any issues. As you can see, the slides are here in the webinar, and there are also a few other documents that Denise will reference. If you do have any questions or concerns after the webinar, you're welcome to email Denise directly or me. Thank you. And now I'm going to hand it over to Denise, who's going to start talking about partner services.
Great, thank you, Katie. Good afternoon, everyone, and welcome to the Partner Services Overview for Clinicians and Other Care Providers webinar. My name is Denise Tafoya-McNevin, and I am the Program Manager for the California Disease Intervention Services Training Center, or DISTC. Our DISTC is one of 3 national centers funded by the Centers for Disease Control and Prevention. And we are funded to provide partner services training and technical assistance to community-based organizations, as well as to local and state HIV and STD prevention programs. At the end of this webinar, you're going to be able to define partner services and then list those core principles that are at the heart of this work. It's also important for you to hear how a confidential notification occurs, what is said, what is not said, so that way you can describe to your clients, should they inquire about, what is the process like and what exactly is going to be said. It's also important for you to understand how partner services are designed to support your patients. So you're going to hear me convey the importance of partner services programs that they place on early HIV treatment and linkage to care. And then finally, I think that everyone should feel a lot more comfortable with incorporating some portion of partner services into your practices. So I'm going to be really sure to offer you some very concrete ideas and examples. I would like you to start thinking of partner services as a holistic approach to impacting the health and the prevention needs of your patient. Here is a depiction of interlocking system of interventions that can help our patients live healthier lives and also to intervene in the spread of disease. So in order to break that chain of infection, we need all components to interact. So if you think of this as a Venn diagram, then each component supports and enhances and strengthens the other. And it's really an effort to strengthen the core. And that core is your patient. So if the components of clinical and behavioral management have been integrated into your patient encounters, then a majority of partner services work has already been initiated. Performing the risk screening and behavioral assessment are both key components to effective partner services, just as partner services are an essential piece of performing a risk assessment and developing tailored interventions. So before I get too ahead of myself here, let's just answer the first question. What is partner services? So in short, partner services is an evidence-based HIV and STD prevention strategy, and it's meant to prevent new infection or disease and then quickly identify those who are infected in order to direct them to treatment, care, and other prevention services. So the ultimate goal really is to head off complications and negative health outcomes, especially for the unborn. And that really is the standard of partner services work, which is to try to achieve both primary and secondary intervention. So partner services inherently does include counseling and education to address risk reduction and to provide necessary information in order for that patient or that client to make an informed decision around treatment and medical care. Now, because HIV co-infection with syphilis and gonorrhea have become quite commonplace, general education around all STDs is very worthwhile. And partner services just as a whole really does aim to empower the patient or client along with their partners and their social contacts. And I think from here forward, I will use patient and client interchangeably. Partner services programs can, first, I just want to mention that they can encompass many microservices. So that might involve a partner services provider working with or conducting direct observation therapy for tuberculosis patients. It could be a provider-delivered therapy for partners of those with chlamydia, or perhaps assistance with hepatitis or some other kind of a communicable disease outbreak, where we would be working very closely with epidemiologists and public health staff in the local area. But the essential group of activities or functions for most HIV and STD partner services and prevention programs are partner elicitation. This involves interviewing and counseling those with HIV or some other STD to identify all sex and needle-sharing partners that require testing and treatment. After determining that someone, an individual needs to be interviewed and counseled, most programs do expect that a partner services provider or a PS provider would make sure that that session was accomplished within 24 to 72 hours. And this really kind of jumpstarts that whole process of notifying those at greatest risk of having been exposed to HIV or another STD. Partner notification entails contacting the partners. That can be done by phone or perhaps a personal visit to confidentially inform that partner of exposure to infection. This may also include us having to connect with partners through text message, social media, or by way of email. But all of those things will be done certainly with extreme caution. And even if we did have to leave a message, the message does not identify the infection at hand. It's basically just a very brief message that ask that the partner please contact the partner services provider. Some areas will allow the provider to add a little bit more and say, please call me regarding or get in touch with me regarding an important health matter. But that is all that is left, and not anything beyond that would be added to the message. So partner services providers are typically expected to notify a person who comes to our attention within 24 to 72 hours as well. Another essential partner services activity is HIV linkage to care and in re-engagement in care by working with our surveillance staff to identify those who are not in care so they can be approached about perhaps seeking some medical attention. And the expectation for that for most programs is that that bit of work gets done within 1 to 2 weeks. Some of the other essential activities involve syphilis and congenital syphilis case management, as well as identifying and then extending appropriate social service referrals or other wraparound service. All partner services work is based on a core set of principles. And we'll start with the first principle here, which is that partner services are voluntary and they are non-coercive in nature. So no one's ever going to, not be allowed to access certain services. They're not going to be denied medical care because they elect not to use partner services or they elect not to discuss their partners. This is a free service. It's available to everyone at any time, and this is very ongoing in nature in terms of being able to kind of tap that later if you are ready and you're comfortable to take the service. Partner services also strives to be both culturally and linguistically appropriate, but most importantly, the core principle, in my opinion, is that they are conducted in a confidential manner, and all partner services work is approached in a confidential manner. So not only are there core principles behind partner services work, but there are also some essential skills for effectively conducting this type of work, because at times it can become a little bit, involved, a little intricate. I'm sure that most of you utilize or incorporate many of the skills in your interactions with your clients that you probably see here. But for partner services work, everything here is critical. It is essential. Starting with the use of open-ended questions. That for this type of work is an absolute must. And questions can be posed in a way that, we're not coming across nosy, but more inquisitive, so that way we have a better understanding of what is going on in our client's life. So it does help us to gain richer, fuller, just better information. Can help us to understand where we might want to go next with, a question. It can indicate how we might be able to support the patient when they, answer an open-ended question that is posed to them. And very often it can help us, assist in determining the most appropriate referral for the person in front of us that we're working with. Problem solving is another essential, tool for us, and that is conducted or accomplished by way of very intent listening and an ongoing assessment that occurs throughout the course of the conversation, and then appropriately responding during that session. And I have to say that, it's very much a skill to be able to do these things and kind of drill down to what the real issue is, in terms of perhaps someone not wanting to maybe move forward with conversation, or they are feeling a little bit stuck. And I think that just being able to take the time to get at the underlying issue is worth your time. It feels like you might be slowing down a little bit in your conversation, but taking that time is absolutely, it's a wonderful investment in the conversation and your patient, and usually results in a good outcome for everyone. Now, no one likes a bully, no one warms up to a bully, and no one wants to talk to a bully. So this is why partner services work is approached in an assertive manner and not in an aggressive manner. We want to use an assertive approach toward all the work, so that way we know that we're doing the best that we can for the patient that is there in front of us, but also we want to make sure that we are an advocate for those partners who are not in the room and can't advocate for themselves. So we do maintain an assertive approach when we are working with other clinicians or offices, just so that way we can use and obtain the best information to help manage things for our patient. Everything is for the benefit and the goal of the patient here, as all of your work is as well. I did mention earlier that partner services aim to empower people, and this is done by offering options and not directives. And I'm sure that, like in your own personal relationships, when someone is telling us what to do or telling us we should be doing this or that, it doesn't always feel that good. And so we want to, so in partner services work, we do our best to remember that and want to make sure that the patient is in control and that they are guiding the next step for themselves. A non-judgmental communication approach is certainly essential for a positive outcome, and as you know that really impacts the quality of communication. So being able to not being judgmental in maybe language or even in your nonverbal communication is also critical. We don't want to do anything to try to ruin a really good relationship that's been established with the patient, or a good relationship that perhaps been established between the patient and your agency or your organization. And most importantly, we never want to discourage a client from linking to or perhaps remaining in medical care. I think that would be tragic. Partner services work certainly demands us to keep our own personal opinions and biases, out of things. And are we allowed to have those? I mean, absolutely. Everyone is entitled to have personal opinions, and I'm sure most of us have some kind of a bias or a little bit of judgment about some things. If that is the case, we'll take that and we'll put that on the other side of the door 100% of the time, because it has no place in any kind of partner services work or interaction or activity. Partner services does underscore our need to also acknowledge our patient's reality. And I think that begins by being patient enough to understand those barriers to talking about partners, perhaps barriers related to disclosing one's status or even entering medical care. And I just think that, sometimes we just want so much for our patients and our clients, but, we might be failing to hear their reality or maybe fully appreciate the barriers that prevent them from taking certain actions that would seem, obvious to us or to someone that is not in their position. The most essential skill of partner services work, I think the cornerstone, is practicing and always emphasizing confidentiality through all aspects of partner services work, but especially when notifying a partner or even a social contact of exposure to infection. So there are two essential partner services activities that I would like to focus on from here forward, and that is partner notification and HIV linkage to care. So let's start with partner notification. Here we have the greatest opportunity to identify those with HIV and or another STD who might be completely unaware of their status. Notification provides a message of exposure that represents real risk. There are 5 partner notification options that are available and universally utilized based on CDC recommendations and guidelines. We have 5 different notification options that I want to just kind of briefly walk you through. The first is the provider referral, where a trained health department partner services provider would reach out to the contact. Of course, they would make sure never to reveal the name of the original patient. That is the person who provided the name of the partner. And we would make sure that that person remains anonymous, that original patient. We would reach out to them very quickly, to the partner very quickly, and make sure that they got the appropriate care that they need. Another way to notify the partners is to have a patient do it. And very often I might have a patient that says, you know, Denise, I'd like to get in touch with my partners myself. I feel like I should talk to them about this. I think I can do this just based on the information that you provided me with. And when that's the case, I say that is great. Something I might add to that is maybe a little bit of coaching with the patient, just so that way they feel comfortable about how to approach the conversation with the partner, what to do if you know, certain reactions or questions are posed to them. And I'm just really trying to build their capacity to actually have the conversation, so that way everyone knows that the partner got notified. Another way to get in touch with partners is by way of something called a contract referral. The contract referral is where a patient might come to me and say, Denise, I have been with this person for many years, actually a couple of people for many years, and I would really like to talk to them myself. But if for some reason I can't do it, or I decide I really don't want to do it, would you be able to get in touch with them for me? And the answer is absolutely not a problem. I'd be happy to do that, because I understand that sometimes patients do have the very best of intentions when they're with us, but after they leave, perhaps some of that confidence, you know, dwindles or diminishes, and they do need support, and they want the partners to get notified. So in that situation, you know, we'll make some, you know, an arrangement with the patient and just say that, let me know within the next, you know, couple of days if you were able or not able to reach out to your partners. And if you weren't able to, not a problem, I will go ahead and reach out to them myself as a provider. The fourth partner notification option is a third-party referral. That is where someone like yourself would actually get in touch with the partners. That's another great way to make sure that people are notified of exposure to HIV or an STD. I would say that if you're interested in taking on that piece of partner services work, that perhaps you would consider some training around that, just to develop your skill and to make sure that you feel very confident that you can have the tools that you need to manage that kind of a situation. And we do offer that type of training with the DIS training centers. And I'll talk a little bit later about the programs that we have available to assist you in that type of skills development if you'd like. And last but not least is a dual referral. This is where I might have a patient tell me that they have been married to someone for many, many years. They want to be the one to let their married partner or their steady partner or any partner know that they are living with HIV or syphilis or gonorrhea or whatever the STD is at hand. But they might be feeling a little bit shaky in terms of having that conversation, and they kind of need someone in the room to be like moral support. So in this dual referral, it's talking about the patient sitting down in a room with the partner in the presence of a partner services provider. But before that occurs, the patient and the PS provider talk a little bit about, you know, how the session will unfold and what everyone's role is. The patient's role is to actually tell the partner that they have this infection and, you know, gently encourage them to test. And the PS provider's role is to make sure that they address any kind of technical questions that the partner might have about testing, what a result could mean, when results will return, and how is this going to be all managed. So that really is mostly the role of the PS provider in that situation. So that is kind of it in a nutshell. But for now, I just would like to focus on the provider referral, where a trained health department partner services provider is conducting the actual notification. I may have said this a little bit earlier, but it can be a little bit delicate. Things can be very delicate, and there are a lot of considerations, and I would even say different dynamics at play when notifying someone of exposure to HIV or an STD, as you can imagine. The greatest consideration around notification is confidentiality. I think that typically this is the #1 reason why a patient doesn't want to talk about partners or perhaps reveal a partner's name, along with not knowing what that partner services provider might actually say to the partner. So in the world of partner services, we expressly mean that a PS provider will never provide the name of the patient who asks that that partner be notified. Not even a nickname is going to be given to that partner, should they ask, or even just volunteered that type of information. We're not going to do that. We will also never provide information about when or where the exposure occurred. And we're not going to be discussing the type of exposure that that original patient had with this partner, because perhaps the original patient is the only person that that partner has shared needles with, for example. So it'd be easy for that partner to figure things out. So we're not going to go down that line of conversation, and we're not even going to get into any kind of discussion about the physical description of the person who asked us to reach out to that partner. Oftentimes, you'll have a partner who asks us something like, "Okay, Denise, I get it. You can't give me the name of the person who asked you to reach out to me, but is this person about 5'2", kind of has short reddish curly hair and a tattoo of a little heart under her left eye? Is that the person who named me?" When that occurs, and trust me that these types of things happen, I call it a kind of a guessing game. I just let the partner know that I'm not here to discuss anything about this person who asked me to reach out to them, just as I am going to protect their privacy. I also need to respect the privacy of the person who asked me to reach out to them. I will let them know that my sole purpose for being there in front of them is to let them know that they have been exposed to HIV or whatever the STD is at hand, and that I'd like to talk to them about what they would like to do next and to answer any questions they have. So that is a way to get away from that type of a situation. And it can be a little bit uncomfortable when that occurs, but providers are trained to deal with that type of a situation as well. So in a nutshell, providers will not be giving any kind of specifics about the original patient to anyone ever. And this includes third parties. So a third party might be someone who is responding to a phone call or answering a door, or just kind of in the way in between you and that partner that you need to reach out to. So that could be a roommate, it could be a mom, a friend. And I have to say that these types of third partners are notorious for asking the provider what the matter is, concerning, or you can tell me, and they're really good friends. You can trust me to pass this information on to them. When that happens, the partner services providers are trained to get away from that situation and to let them know that they will just come back later, or they'll just reach out to the partner at a different time. So they are trained to manage these third parties as well as dangerous situations that could potentially occur during a notification. Bottom line is, we want to, when the partner does inquire or she gets stuck on, well, who asked you to come out here and reach me and talk to me, we are going to redirect that partner's questions to really just focusing on them instead and working with them. This piece of partner services work, again, can be a little bit tricky, sometimes challenging, but I think it's a very necessary component or piece to stopping the spread of HIV and STDs. So after a provider is in front of the partner and they have described who they are, perhaps maybe shown credentials like an ID, and they have confirmed that they are speaking to the right person, just based on a physical description that the provider would have of the partner, and the provider has also secured a private space to have a nice private conversation, then the provider will confidentially inform that partner of exposure. So at that point, then, what does the partner services provider say? Well, here's just one example of something that can be said to the partner. A person who has tested positive for HIV has asked me to reach out to you to let you know that you've been exposed to HIV. I'm here to help you get tested and treated if this is something that you would like to do. I can also answer questions so that way you can make an informed decision about what you'd like to do next. What have you heard about HIV? I think that last question, that last open-ended question that you see posted here is a great way to kind of figure out where you go next in terms of this conversation with this partner. But very oftentimes, this is going to launch onto a conversation that is supportive, that provides education, and really highlights the benefits of testing and knowing one's status. Now, if the person being notified is already living with HIV, for example, the PS provider will inquire about whether or not this person is in care. If they are out of care, then the provider is going to highlight the benefits of being in medical care. They will explore reasons for perhaps falling out of care or not seeking medical attention. And then they'll do their very best to motivate this person to engage or re-engage in medical care if this is what the partner desires. There'll also be discussion about pre-exposure prophylaxis or PrEP, even in advance of knowing whether or not the partner has HIV, because we do want the public to know what is available and all that is possible. So again, the provider's role is to extend information that enables that partner to make the best decision for themselves and then how to move forward. So at this point, I'm really hoping that you've identified some benefits of partner notification, again, an essential piece of partner services work in general. If you just take a look at this particular slide, I think it just kind of sums things up about partner notification, and that is that it really is an opportunity to have patients informed of exposure. It keeps the original patient anonymous if this is something that they desire, and it really is a way to intervene in the spread of infection. And we certainly want to make sure that we put a lot of priority on those partners who are pregnant or of childbearing age, because we want to make sure that if certainly we have a partner who is pregnant, that we don't want transmission to occur to the unborn. So we're always thinking about the unborn. And I think even for us as providers, some of the benefits are just knowing that we fulfilled a public health and maybe an ethical concern or obligation that we feel that we have, and that overall it can work to improve our patients' just overall wellness, and their health outcomes can improve as well. So let's talk a little bit about HIV linkage to care, another essential partner services activity. In many areas, there are PS providers who may be able to help support your practices. They can potentially assist you with linking a patient with HIV to your agency for medical care. Most prevention programs or partner services programs would typically expect a PS provider to remain in contact with that patient, at least through attending that initial medical appointment. They will also reinforce some basic HIV information. Sometimes it might get a little bit more beyond basic, depending upon what the patient already knows about HIV. And anything that involves things that are technical or requires more of an involved medical explanation, we will leave that to those of you on this webinar or up to a clinician. We will have cursory conversations, as I've already mentioned, about PrEP, but we'll also be just discussing in general post-exposure prophylaxis, PEP, as well as antiretroviral therapy, ART, during the course of conversation with all the patients and partners. I do want to say this, though. The discussion of a specific treatment for a particular individual is not going to be something that is something we would be discussing with this person. That kind of a conversation would need to be directed to a clinician, and that's what we do to make sure that the clinician is certainly the one here who holds the medical license and could answer that question for the partner, should that partner be living with HIV or some other STD and needs to know how things are going to unfold in terms of the treatment. Another thing that, or another way that a partner services provider can support your agency is to possibly assist you with locating and re-engaging those patients who have fallen out of care from your agency. Most programs would expect that the partner services provider, again, would have this done within 1 to 2 weeks. The whole goal is to get in touch with, to do things quickly, but we're going to do things quickly and thoughtfully. That's what I want to say, quickly and thoughtfully, because we want to make sure that there isn't any opportunity to have transmission of infection passed on to others because we are slow in action. We don't want that. So partner services staff can also direct your patients to other services through offering either an active or a passive referral to either housing, food banks, some kind of a drug assistance program, case management services, just a host of other wraparound services. In some areas, and I can't speak for all of the prevention programs across the country, but in some areas, the partner services provider is allowed to transport a patient to a medical appointment, and that is typically to the initial medical appointment. As prevention programs or partner services programs, they are stretched, and we certainly have a finite number of staff. Overall, partner services really does work with all of you and with the patient toward that goal of achieving viral suppression. And we, in part do some of that by discussing the benefits of early linkage to medical care with the patient. So partner services work is designed to enhance and to complement medical care and to reinforce key information and health messages that each of you provides during your own client encounters. And here on this slide are some of the main benefits, or I like to think of them as motivators as well, that we discuss and that will reinforce to encourage HIV testing and engaging them into to care for those who are living with HIV. We will make sure that we really focus on this discussion around minimizing transmission to others through treatment. We will talk to them about living a healthy life by getting dialed into medical care, so that way that space can also be used to perhaps help them manage other chronic health conditions, or perhaps assist them in working through addictions. I think that some of the other things that most of us partner services providers will also discuss is by entering medical care that we can reduce the chance of advancing to AIDS through that medical care and treatment. And by partnering with people who are dedicated to them and that are true experts around HIV care. And of course, we're always going to be talking about, increased T cell count and really trying to reduce that viral load. And again, describing access to and availability of ART, PrEP, and PEP. Just overall, really wanting to help the patient understand the purpose and the usefulness and the satisfaction that they could obtain by just having, getting themselves into medical care, so that way there is some kind of an ongoing immune system monitoring. So STD partner services programs have been involved, as everyone knows, for decades with treatment as prevention of syphilis, gonorrhea, chlamydia, given the availability of antibiotics. Now with the development of an access to antiretroviral therapy, acknowledging that much work still needs to be done around such access for all, we can think also treatment of HIV leads to prevention of HIV. And I think that the U=U campaign, reaching that undetectable viral load, making one unable to transmit HIV, is really everything that a partner services program is working toward, wants to is behind, and works with the patient to try to achieve, along with all of your work and your efforts here as well. Okay, let's make a little bit of a gear shift here and discuss ideas around incorporating partner services activities into your practices. If you recall that Venn diagram that I showed you a little bit earlier, I mentioned that partner services begins with assessment. So that's something that you do routinely. I am just suggesting here that as part of your assessment that you incorporate asking whether or not all sex and needle sharing partners have been informed of exposure at an initial visit with you, or at periodic just follow-up visits with you or with your agency. Because we might have those additional partners that would also need to be extended the opportunity to test, and if they are infected with an STD, to make sure that they get treatment. And we all know that people do not stop having sex after an HIV diagnosis, for example, and people shouldn't, and they don't have to. I think that we just want to keep partner services in mind here, and just continue to remain committed to identifying new partners in order to offer them quick access to care. Something very important to point out here is that your patient may not be ready to discuss partners at their initial session with you. And that's okay, because we can always swing back around in the future and address the subject at a later time when they are more open to it. So there are many ways to bring up the subject of partners, and I just wanted to share one example with you here. Something that you could, potentially say is, now that we've talked about ways to keep you healthy, let's talk about some of the ways to keep your partners healthy. How do you feel about telling your partners they've been exposed to HIV or whatever the STD is at hand? That last question, how do you feel, that open-ended question, is a great way to gauge. Are they ready to talk about partners? Are they not? If they're not, that's okay. I would probably, if I get a feeling that they're not, I might make a normalizing statement by just letting the patient know. I ask all of my patients about their partners, and this is just, another part of your care. But when you're ready to, to talk about this subject, we can always return to it. And then I would see how the patient reacts at that point. I do have to say that often times patients and clients are waiting to have a conversation about sex and needle sharing partners with someone. They're looking for that opportunity, and I say let's provide that opportunity. Believe me, your patients, your clients, they've been thinking about who may have infected them, or as well as whom they may have passed infection on to. If your client does tell you that they do want some assistance with managing their partner or partners, you can discuss the various notification options that I walked you through a little bit earlier. Ideally, you would describe how a trained partner services provider from the health department could support this effort. Here is just an example of what you could say to your patient. I think that decision to let others know that they've been exposed to HIV and STDs or an STD is a thoughtful one. I want to tell you about a free service that's available to you. It's called Partner Services. A specially trained service provider can reach out to you and help you decide how each partner can be privately contacted without revealing your name. If you want to talk to certain partners yourself, they can also help you kind of coach you around what to say. My office works with the local health department quite closely to provide the service to you and to your partners. How interested would you be in this kind of support? I think that right there, again, helps you to know how open they are to the idea of talking about partners and reaching out and making sure that they are informed of exposure. And really what you're doing here is with this open-ended question, just assessing that patient or client and knowing where to go next. If there is interest, I would suggest that you work with or call your local partner services program manager to have someone work with that patient or that client, if this is what they agree to, of course. And if you also think that it would be, more efficient for you and your agency, as I recognize that you have, finite resources as well in your own organizations. So this kind of brings us to the need to know, well, who is that person in my area? Who am I to reach out to? I do have a handout available that lists state STD program managers, as well as all of the state HIV and AIDS directors across the country, so that way you can reach out to them. They can help direct you to the local health jurisdiction partner services program. So that way you can start creating this environment for partner services in your office. And it's also a good way to start improving, that partner referral system. How's that going to work between my office and the health department? Who is my contact person there at the local health department, and how do they want me to reach out to them when I do have a client who is interested in partner services, and most of all interested in having someone who is trained reach out to those partners and notify them of exposure to infection. I would also say that these partner services programs may have literature that is available that they can extend to you, that you can then in turn turn around and give to your patient population. I would say that something that would be of extreme value is to inform your patients about the role of public health as part of their care, and just really being part of their prevention team. And anytime you get the opportunity to address misconceptions about partner services or the health departments even, that would be, I think, very positive for everyone, just all the way around. So before I wrap up here, I would like to share a real-life example of a HIV partner services case that was managed, and we are not revealing any names of anyone, so there will not be any kind of a breach of confidentiality here. There we did have a 22-year-old male. He elected to test for HIV in a correctional setting. Now, his reason for incarceration was a probation violation related to drugs. Throughout the assessment, much information was obtained, but he mentioned that he did not shoot drugs. When he did test, it was positive, and at that point, a partner services provider from the health department was sent out to the prison to talk to this man, to provide education, and to offer partner services. He elected to utilize partner services and asked that the provider reach out to his 3 female partners. So they were contacted. Unfortunately, one was unable to be located, but 2 of the women were contacted. They happened to live in the same city, and when they were notified, they both elected to test for HIV, and they both did have HIV. So I want to tell you a little bit about the first partner of this man. She was a 19-year-old female. It was his steady partner, actually. She was just about to enter nursing school and had come from a very religious family, and she just found it very difficult to believe that she had HIV. In fact, that she decided to test an additional 3 times, each with the same result. She was pretty bitter about it and very angry at the situation because she said that she had only had sex with one person in her entire life. It was with a man. And so she really felt like, she knew who her source of infection was. She also communicated to the provider that she had no other risk factors. She did not use drugs. She was also offered partner services. She elected to utilize them, And in the course of conversation, she did name back the original patient, the man who asked us to reach out to her. She did choose, and I'm so glad about this, to enter a medical care program. And at the end of the man's release from prison, they actually reunited and continued to move forward as partners. So what about this 20-year-old female? Well, at the time that she was notified of exposure to HIV, she was literally, I think it was like within days of being notified, she was scheduled to leave the state and attend college. She, couldn't understand really what was going on. It was hard for her to believe that she would be at risk for HIV. She was pretty indignant about, her lack of risk, stating that she didn't have sex with men, that she only had sex with women. She wasn't an injection drug user, and there wasn't anything else that she was doing that she felt was putting her at risk. But she ultimately decided, for her, she wanted to test for HIV. That was positive, and she also elected to use partner services. In fact, she opted for that dual referral, and where she sat down with the partner services provider and the partner all in the same room. She did reveal her status to the partner. The steady female partner decided that she would test as well. Her result was negative, and something that came from that, or that remained intact, and I'm so happy about that too, is the relationship remained intact, and the two of them continued to move forward. They went on with their plans to move out of state, and the one person who was going to college decided to keep moving forward with their college plans. And the patient actually immediately entered medical care and then returned annually for the next 3 years after that, to just make sure that she was keeping on top of her health. I imagine that she probably, over time, because we lost track of her, started to receive care at the state where she was attending college. Okay, so what happened to the man who we originally spoke to? Well, when he was released from prison, he thought it would be a good idea for him to make sure that he got, dialed into medical care. And he and the 19-year-old steady girlfriend that I mentioned earlier decided to routinely go to the same medical care facility. So they were very supportive of one another. During one of the follow-up sessions with this man, he was asked about any new partners, especially since being released from prison. And at that time, he did name an additional 3 individuals. And one of those partners was a 16-year-old girl who had fairly recently given birth to his child. She was unable to be located, and unfortunately, so were the 2 other partners. And, sometimes that's the way it goes. I just think that overall this, real life story, stresses the ongoing nature of partner services. This man was offered it, when he first tested positive for HIV, and then also at a subsequent session. And that's because we want to make sure that we're addressing, changing needs and life circumstances of our patients. I think that this real life situation also demonstrates how partner services, specifically, speedy notification, led to 2 women learning their HIV status, where they both were completely unaware, had no reason to believe that they could be at risk for HIV. So, likely probably would never test for HIV, but for our being able to reach out to them and give them the information that they needed to make the best decision for themselves. And with both of these, female partners being of childbearing age, knowing their status, I think, is even of greater importance. And this situation also acknowledges the limits and the limitations and the challenges of partner services, like not finding all of those partners, which, I must say it's extremely frustrating. We really, work do our very best to make sure that we're working hard to get that information to that partner, because they do have a right to know this information. But even with the best of efforts, we are still not going to be 100% successful in perhaps notifying and being able to prevent a new infection. But we approach this work with 100% effort. I also want to tell you that confidentiality was maintained for the original patient, the man, and for all of the partners. So take-home messages regarding partner services. The confidential service that a person elects to use, it's an assistance program that's available to confidentially notify partners or social contacts of exposure to HIV or STDs. It is a body of care providers that can assist with linkage to medical care for those living with HIV. It's free, it's ongoing, and it is available to anyone at all times. Also free and available is an online product for those of you who might want to learn a little bit more about partner services or want to reinforce some of the information that I've discussed here with you today. You'll see that on your screen. It's Passport to Partner Services, Track A. There are 4 tracks, A, B, C, and D. This Track A is an online module that's about 60 minutes in length, I would say, and it does offer free CME and CNE credit. So that is available. I would encourage everyone to go to learnpartnerservices.org and explore, not only the Track A program, but perhaps you want to take a look at the other programs as well. Or if you simply just, would like to see the different online modules that are connected with learnpartnerservices.org, please feel free to go there and then choose, just kind of click on Browse All Modules. And this will allow you to view all the online modules related to various infections, diseases, and associated concepts, along with modules related to STD and HIV, interviewing, and counseling skills. I'm also making a handout available to you. It is a Passport to Partner Services course description handout, so that way you can look at it if you're interested, so that way you can determine the most appropriate track for your learning needs. If you need to reach me directly, here's my contact information. Please feel free to reach out at any time. I'm more than happy to assist you in any way possible. And I want to thank each of you for attending today's webinar. And I'm happy to address any questions that you might have for me at this time.
Thank you, Denise. Thank you for an informative and informational interactive webinar. So we do have a question from Sally from Florida. She says, thank you very much for an awesome webinar. I was wondering if partner service providers are trained on trauma-informed care, anger management, or conflict resolution?
We actually do have a course. It's called Top Safe, and it's a safety course. It's a one-day program, and in that program, we do talk about, how to resolve conflict, how to identify when a situation is about to escalate, and that is when we're out in the community, working with people, trying to identify someone, maybe perhaps locate a partner, and things, as you know, this type of notification is very sensitive, and it has the potential to escalate. And people get very, emotional and can get very upset about just hearing the fact that they have been exposed to, syphilis, for example. So we do provide that type of training. Trauma-informed training is something that we need to build into the core curriculum surrounding partner services training, and make sure that that is something that all partner services providers do take. I think that I would say that, going forward, this is something that really is being really considered and looked at, and I think that that is, again, going to be something that is part of the core curriculum when it comes to training partner services providers.
Great. Well, thank you, Denise. I think we're just about out of time, so I'm going to ask Denise to advance to the next slide. So if you feel like you do need capacity building assistance services, you're welcome to click on this link below or type it into your browser, and we can help with strengthening HIV prevention initiatives, including some partner services activities. And in the next slide, the same website where you registered for this webinar, you can see that you can access the Denver Prevention Training Center. Denise also offered her email address and her California Prevention Training Center web address, so you're welcome to visit that web page also. We'd like to thank you for your time and dedication for this webinar and to the field of prevention and treatment. Thank you all, and I hope you have a great afternoon.
Thank you.